Hello, and thank you so much for joining me today for the Medicare Extra Help Program and Medicare Savings Program presentation. My name is Melissa Devine, and I am with the Medicare Medicaid Assistance Program. Today, we will cover who MAP is, what MAP does, an overview of the Extra Help Program, an overview of the Medicare Savings Programs, and how to apply. Let's get started with the Medicare Medicaid Assistance Program. The Medicare Medicaid Assistance Program, often referred to as MAP or MMAP, is comprised of certified counselors who've been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company and they are not licensed to sell insurance. In many states, MAP is called the SHIP program or the State Health Insurance Program. A MAP counselor can help you understand new healthcare options, understand Medicare and Medicaid, can help compare or enroll in Medicare prescription drug coverage. A MAP counselor can also help review Medicare supplemental insurance needs, understand Medicare health plans, apply for Medicaid or the Medicare Savings Program, and identify and report Medicare and Medicaid fraud and scams. Now we're going to learn a little more on getting help with your Medicare prescription drugs or the Extra Help Low Income Subsidy Program. The Extra Help Program helps with the costs of Medicare Part D drug plans that add up, like the Part D plan premium, the deductible, the prescription drug copayments or coinsurances. And with poverty among the Medicare population at nearly half, or 25 million, those that have that income under the 200% federal poverty level are likely eligible for the Low Income Subsidy Extra Help Program. On average, the value of the Low Income Subsidy Extra Help Program for an eligible person is around $5,000 a year. The Low Income Subsidy Extra Help Program allows people to be able to get prescription coverage. Without this program, many low-income seniors forego Part D coverage and will not take the medications that are necessary to remain healthy. Having the Low-Income Subsidy Extra Help Program also helps waive any late enrollment penalties that come from Part D. It also allows for a continuous special enrollment period. This means that somebody can change their plans once every 3 months without having to wait until the open enrollment period to change their coverage. There's a couple of key federal players in the Low Income Subsidy Extra Help Program. Those would be the Social Security Administration and the Center for Medicare Medicaid Services, referred to as CMS. They work together to help administer and educate the public about the Extra Help Program. Social Security handles the application and the eligibility determination, while CMS administers the program and handles the Part D assignment for those that are eligible. In order to be eligible for the LIS Extra Help Program, you must have Medicare Part A and or Part B, live within the United States. You must meet the financial eligibility criteria, which is an income and asset test based on the annual federal poverty levels. Some people may automatically be qualified for the low income subsidy. Those would be Medicaid recipients. And once eligible, all that gain access to the low income subsidy for at least the remainder of the year get to keep it. There are two levels of help from the low income subsidy. You've got full help, often referred to as the full subsidy. That's for those with the lower incomes and fewer resources. Then you have the partial help or partial subsidy for those with the slightly higher income and resources. Both levels eliminate the Part D coverage gap, and both levels eliminate the late enrollment penalty premium. For those looking to gain access to the low-income subsidy or extra help program, you'll want to look at the categories labeled full help or partial help. The monthly incomes are gross, and your assets can total no more than $9,470 for a single individual looking for full help, or $14,960 for a married beneficiary looking for full help. And for partial help, a single individual can have no more than $14,790 in assets, with a married beneficiary looking for partial help having no more than $29,520 in assets. Again, the monthly income levels are gross, but you can see with the full help or full subsidy, there is no premium, no deductible, a $3.70 copay for generic medications, a $9.20 copay for brand medications, and for those on the partial help subsidy, there's a sliding scale premium, a $92 deductible, and a 15% copay for brand or generic medications. When it comes to the income test, there are countable incomes and excluded incomes. Countable incomes for the low income subsidy income test include Social Security benefits, pensions or annuities, wages, again, that are gross, or earnings from self-employment, alimony, rental income, and workers' compensation. Excluded income includes food stamp benefits, fuel assistance benefits, $20 monthly in unearned income such as Social Security, and work-related expenses for people who get Social Security benefits for disability or blindness. Much like the income test, the asset or resource test has countable resources and excluded resources. The countable resources include financial institution accounts like a checking, savings, or CDs, any cash at home, stocks, bonds, savings bonds, mutual funds, IRAs, 401ks, real estate, equity value other than your primary home, and certain trusts that allow a person to revoke or have direct use of funds. Excluded resources include the home in which the applicant lives, all vehicles, whether it's an automobile, truck, motorcycle, boat, snowmobile, etc., any household goods or furnishings, and personal effects like jewelry, any cash surrender value of life insurance policies, in-kind support like a non-cash help as shelter, and irrevocable burial trusts or burial contracts. You can apply for the low-income subsidy or extra help program online at Social Security's website. That's ssa.gov. The application is available in English and Spanish, and Social Security will accept an electronic signature to complete the application. You also can gain access to a paper application from Social Security. All you have to do is give Social Security a call and have them mail you a copy of the application. Remember, Social Security is the one who makes the determination for the application, typically within 3 weeks of the completed application. You'll get a letter from Social Security telling you whether they are going to offer full subsidy, partial subsidy, or no subsidy. A few tips when applying for the Low Income Subsidy Extra Help program. Doing it online is usually easier and faster. There's no verifying documents needed, and if using a paper form and it's incomplete, Social Security will follow up with you via phone, and the online application cannot be submitted until it's complete. Now, let's take a look at the original Medicare assistance through Medicare Savings Programs. The Medicare Savings Program matters because Medicare isn't free. Medicare is the primary insurance for seniors age 65 and older and many younger adults that receive Social Security benefits through disability. For many people, Medicare can be unaffordable because Medicare is not free and out-of-pocket costs will add up. Here's a quick overview of the Medicare savings programs. There's the Qualified Medicare Beneficiary, referred to as QMB. It helps pay the Medicare Part B premium, the Medicare Part A premium, and all Medicare Part A and B deductibles, coinsurance, and copayments. There's the Specified Low-Income Beneficiary, referred to as SLMB, and it helps pay the Part B premium only. And then you have Qualified Individuals, or QI, and it helps pay for the Part B premium only as funds are available. So what are Medicare Savings Programs, or MSPs? MSPs are Medicaid administered programs. They help cover the Medicare premiums and cost sharing for those with Medicare who have limited income and resources and do not qualify for full Medicaid. MSPs, quote unquote, buy those who are eligible into Medicare Part A, B, or both. So who's eligible for the Medicare savings programs? Well, an individual that wants access to the Medicare savings program must have Medicare Part A. They must meet the income and resource eligibility testing. They must submit an application through the Department of Health and Human Services, and their eligibility is generally redetermined each year. This is a quick look at the Medicare Savings Program income and asset eligibility. For anybody who's single looking to get into the QMB MSP program, their income can be no more than $1,094 gross each month. If married, the gross monthly income can be no more than $1,472. For the SLMB program, the gross monthly income for a single individual can be no more than $1,308, or for married couples, $1,762 gross. For QI, a single individual can make no more than $1,469 in gross monthly income, and a married couple, again, $1,980 gross monthly income. For the assets or resources, single individuals can have no more than $7,970, and for a married person, no more than $11,960. Again, QMB will help pay the Medicare premiums for A and B, help pay the deductibles and copays for both. There is no retroactive coverage for the QMB program. For SLMB, it will help pay the Medicare Part B premium, and there's retroactive coverage of 90 days if eligible. And for the QI program, it will help pay the Medicare Part B premium as funds are available, and there is 90-day retroactive available if eligible. To apply for the Medicare Savings Programs, you can complete an application either online or in paper form. If filling out a paper application, fax, mail, or drop it off at your local DHS office. You will be required to provide documentation such as proof of identity, proof of income and assets, and of course, any other insurance or bills that are needed for retroactive coverage and to qualify for the Medicare Savings Program. MAP is here to help you. If you would like to speak with a MAP counselor about your specific situation, just give us a call. We are currently counseling over the phone and through Zoom, and our service is confidential and unbiased. No question is too trivial. We often deal with the very complicated questions as well. MAP counselors are trained staff that can help you learn about programs that help, answer questions on current benefits, screen for eligibility for certain benefits, and apply for benefits. So speak with a MAP counselor. Give us a call, 1-800-803-7174. That's 1-800-803-7174. Let's get started today.